have been vaccinated.
Stocking up so there's never another shortfall. That is the goal of Hartford HealthCare's new stockpile of personal protective equipment. Today, it opened its warehouse to our cameras.
NBC Connecticut's Kristen Johnson has more.
This 54,000 square foot warehouse will permanently house a year's worth of gowns, gloves, masks, and face shields.
I believe health systems like ours should be building supply inventories at this level. It's the right thing to do. It's the safe thing to do.
But it's not what hospital systems traditionally did before the coronavirus.
When this crisis first hit, the greatest risk we had, the greatest limiting factor, was personal protective equipment.
In the beginning of the pandemic, as states were competing for the same short supply of equipment, Hartford HealthCare says it often paid 10 times the normal amount for PPE.
We spend about $30 million this year. Typically, we range between about $3 to $5 million in inventory.
The state as a whole has ordered more than $227 million in PPE over the last 10 months, receiving just under $200 million worth.
We have over 175 million pieces of PPE in the stockpile right now. What we've done is we've built up a 90-day stockpile that we essentially set aside just in case the supply chain dries up.
In December, the state ordered close to $14 million worth of PPE, including 11,000 cases of gloves and 20 million surgical masks. It's even turned to Amazon at times.
Most recently, gloves were hard to come by.
Congressman John Larson believes President-elect Joe Biden's plan to manufacture and distribute critical gear stateside will prevent future disruptions.
You want to make sure under all circumstances now and in the case of any future pandemic that you're able to utilize companies and say, you will produce this. You will be paid for it.
Not taking any chances, Hartford HealthCare will keep its stockpile post-pandemic, hoping to become a national leader for its supply capabilities in the years to come.
Everyone else within our society, understandably, is looking to go back to normal. But in healthcare, we're going to be better than normal.
In Newington, Kristen Johnson, NBC Connecticut News.